Vermiform appendix. This is a worm-like diverticulum arising from the posterior medial wall of the cecum, about 2 cm below the ileocecal orifice. Dimension. Its length varies from 2 to 20 cm with an average of 9 cm. It is longer in children than in adults. The diameter is about 5 mm. The lumen is quite narrow and may be obliterated after mid-adult life. Position. The appendix lies in the right iliac fossa. Although the base of the appendix is fixed, the tip can point in any direction as described. The position are often compared to those of the hours and of the clock. The appendix may pass upward and to the right. This is paracolic or 11 o'clock position. It may lie behind the cecum or colon, known as retrocolic or 12 o'clock position. This is the commonest position of the appendix, about 65%. The appendix may pass upwards and to the left. It points towards the spleen. This is the splenic or 2 o'clock position. The appendix may lie in front of the ileum or behind the ileum. The pre-ileal type is the most dangerous type. It may pass horizontally to the left as if pointed to the sacral promontory, called promontoric or 3 o'clock position. It may descend into the pelvis, called pelvic or 4 o'clock position. This is the second most common position, about 30%. It may lie below the cecum, subcecal, and may point towards the inguinal ligament, called mid-inguinal or 6 o'clock position. The appendix which it is seen here is 4 o'clock in position, which is called pelvic position. Blood supply. The appendicular artery is the branch of the lower division of the ileocolic artery. It runs behind the terminal part of the ileum and enters the mesoappendix at the short distance from its base. Here it gives a recurrent branch with anastomosis with the branch of posterior cecal artery. The main artery runs downward to the tip of the appendix, lying at the first near to then the free border of the mesoappendix. The terminal part of the artery lies actually on the wall of the appendix. Blood from the appendix is drained by the appendicular, ileocolic, and superior mesenteric vein to the portal vein. Nerve supply. Sympathetic nerve are derived from T9 and T10 segments through the colic plexus. Parasympathetic nerves are derived from the vagus. Referred pain of the appendix is felt in the umbilicus, similar to that of the small intestine and testis. Lymphatic drainage. Most of the lymphatics pass directly to the ileocolic nodes, but a few of them pass indirectly through the appendicular nodes situated in the mesoappendix.